Good morning. I'm Joe Fetterman from Colliers Life Sciences Advisors, and we're here this morning with John Jacobs, President and CEO of Harmony Biosciences. John, thank you for joining LabNotes.
Thank you, Joe. It's a fantastic opportunity. I appreciate it.
Well, you've had an exciting career, and we're really interested to hear how you got to the helm of Harmony.
Well, look, I'll tell you the journey started in pharmaceuticals on the beaches of Long Island when I was 5 or 6 years old, and right, the summer before kindergarten, my mom would always take me to Cedar Beach on Long Island, and I was fascinated with the horseshoe crabs at that time, and I think they're more under pressure now, but at that time they were all over the beach. We'd get there early in the morning and they would crawl up onto the sand, and I would just gently look at them and then put them back in the water. I got the chance to see the different types of abundant and exciting life that was there on the beach. And then as I got into high school, I got much more interested in biology. It was actually my favorite subject. And in New York State, they have something called the Regents exam, which is a higher level class that you take. So I took Regents biology. I helped to tutor other students on biology. I didn't do that well in some of my other classes, but my parents always taught me, if you follow your passion, if you do something you believe in and you enjoy, you'll be better at it because you want to do it. And just biology just attracted me. I wound up getting a 98 on my score on my state exam, and I missed one question. What are the jellyfish stinging cells called? And the answer was fire cells. And I said stinging cells. I'll never forget it. To this day, I remember that question and debating, because I really went for 100 on that exam. But it's not about the score or the grade. It's just to show you that I was so passionate about it and fascinated with biology. And at the same time, I also always liked advertising. And a lot of people don't like TV commercials and ads, but even as a young kid, when mom first taught me to read before school, she would sit and flip through magazines with me, and I would point to the Shell Oil ad or the McDonald's ad. And so even as a little kid, I liked the way they looked. But as I got older, I wanted to think about, who are they trying to reach? What's that messaging about? Who might their target audience be? So this mix of marketing, business, and biology had been on my mind. In fact, when I got to university then, Joe, I went to State University of New York at Plattsburgh, and originally as a biology major. I intended to study dolphins and sea life in the Caribbean. And then but I was so attracted, I had a minor in business and marketing. And I just merged them into one and wound up getting an MBA in marketing through college, but decided I would pursue pharmaceuticals and biotech because that was this merger of science, business, and innovation. And also, we're really working on the cures and the therapies of tomorrow. And in seeing my grandfather suffer from Alzheimer's when I was at university level, my dad's mom pass away from bone marrow cancer when I was a junior in college, I remember her words. She said, enjoy every day of your life because you're not guaranteed to have another one. And this went so fast, John. It's not supposed to go this fast. Embrace your life and do something special with it. But to see people I loved like that succumb to these diseases, that's when our turn comes for that. I hope, and I think we all hope, that our industry will be there with the doctors and nurses and brave healthcare providers that are there to help us with new therapies and options that could extend our life and give us more. So I think it's just such an amazing industry to be part of. I'm so grateful for it. And it was those early interests in biology and in science and in business that merged together and culminated in my pursuit of a job in pharmaceuticals. So I started out at Letterly Laboratories, if you may remember, who was purchased by Pfizer. Started out in sales, climbed up through marketing, and eventually made my way to Teva, where I led Canada as general manager for their branded business, North American operations for the branded organization and infrastructure. And from there, in October 17, had the chance to join Harmony after a 20+ year career in big pharma, if you want to say. A great way to grow up. We can talk about the differences from that and startup later. I had the opportunity to really, at the foundation, at the very beginning, be one of the first handful of people hired to build something new, which was really exciting.
John, what a great way to talk about how your path unfolded. your passion for what you do comes through so clearly, and
Thank you.
it's
True.
very powerful. You know, the work career can be a difficult path, and to have an anchor and a compass north the way that you do, that passion is really important. And I'm so glad you shared it with us. So you've had leadership opportunities at big pharma,
Yes.
and then have now had the opportunity to really grow something and really get in early stage. So how has that been different? What's it called from you that's been different? How has what you did before informed what you're doing today? Tell us about that whole role of leadership.
Be glad to, Joe. It's a very good question on your part, very insightful. I would say the differences between big pharma and a startup, especially, there's small and medium-sized companies, 50, 100, 200 people, 300, et cetera. But the Harmony I was the fourth or fifth person hired. So we were literally sitting on plastic milk crates. There was a red one. I remember the image in the empty office building space with wires hanging out of the wall, and, just forming the charters and the organization and thinking about structure and how we could possibly build this company. And that was a little bit over 3 years ago. Now we're approaching a 200-person company, over $2 billion in value, as a public organization, which is quite amazing. But to think back on those differences from big to small, first of all, big pharma got big because they're successful, right? Inherently. Many years of doing the right thing, of bringing innovative medicines forward to improve people's lives, and are very good at pulling those through the system in the United States and globally. Organized, professional, good people that are intelligent, educated, and good at their jobs. It was a great way to grow up in big pharma. Coming from university and graduate school, starting out in sales, climbing up through marketing and operations and all of these different roles, all the way to a global general manager, and then leading operations for North America for a 50,000 plus person company. I mean, just exciting things. But I think the discipline you learn, and it's a little bit of a slower burn on the runway for big pharma. You have time to make some mistakes. You have time to learn and grow. You can spend 2 or 3 years in each role, really absorbing the learnings and having mentors who've done that for many years and made a career out of it. To me, that's like my grandfather who grew up in Europe and learned to make clocks with his hands. He did this internship type learning in the early 1900s in Europe, where he would go in as an apprentice. And he spent 4 years learning how to bend the metal to make springs in grandfather clocks and things, and other types of learnings. In a way, big pharma is like that apprenticeship in each role and level. So it was a great way to learn. Certainly in a startup, you don't have all the systems, all of the organization. You really need to know what you're doing, or at least what to ask and who to bring in to help, if you don't, to move something like that along quickly and successfully. So to me, that's the big difference. When it comes to leadership, though, there's not many differences. I think leadership, there are fundamental tenets of leadership that I think I've learned over the years by making mistakes. People say, oh, you're a CEO of a company, you either someone knew you and you had a connection, or you're very likable, or you're lucky, or you're just super smart. It's none of those things, really. To me, it was just loving what I do, being passionate about it, giving it everything I had every day for 30 years. And it just kind of materialized this way. It wasn't a pathway I chiseled out of stone and was determined to get to. It just was an opportunity that emerged from doing what I love over and over, and over time doing it well enough, making more successes than mistakes, and learning from those mistakes. But these tenets of leadership, I think being approachable is very important. And as a new leader, Joe, many years ago, I got my first call and tap on the shoulder. John, you've been President's Club sales rep, #1 in the country on product launches. We want you to be a manager. Go teach 10 other people how to do all that great stuff. And of course, I had all the answers in my early 30s. And in an individual contributor role, if I could only just tell everyone else how to do this, they'd be President's Club winners too, right? Not really. And so I learned the hard way that that's not leadership. And leadership is empowering others to be their best. and to support them and care about them and let them know they're valued. So these lessons are learned over time, a few bloody noses along the way. But I think humility is the key ingredient for any leader, because without humility, you cannot learn. You're not going to be open to learning. The arms will fold, you'll be defensive, your feelings will be hurt if you get feedback. And what that signals to others is, I'm not open to hearing that. I think checking the ego at the door, self-deprecating, laughing at yourself, being the first one to say, Joe, I didn't do that very well. I'm sorry. I messed that up. And you must have felt terrible about how I handled XYZ interaction. So I apologize. How can I do that better next time to help you? And really listen and make improvements. So approachability, being a genuine person. I think a lot of leaders think that there's an expectation. You need to be tough, or you need to do it this way or that way, the 7 secrets, right? Yeah. I think it's much more just about being yourself and treating people the way you would want to be treated. If you walk in the door every day, what do you want from your supervisor? If you make a mistake, if you came in a little late because your child had an issue at home, how would you want to be treated when you walk through the front door, especially after you've given so many hours of your time to do a great job on every assignment? The one day you walk in a bit late because something happened at home, how do you want to be treated? How would you feel if someone berates you for that or calls you out in front of your colleagues for that? I experienced that from other leaders in the past I reported to. They taught me what not to do. Because I remember, wow, I put 70 hours a week in here, got an A on every paper. My wife needed me for an emergency in the morning and they weren't understanding. I went home feeling like I didn't want to spend another hour of my time in that company. Yeah. And the company was great and all my colleagues are great, but and the leader might have just maybe she had a bad day or he had a bad day. But that one interaction just pulled 10 years of energy out of me. And so I was like, I'll never do that to someone that works for me, at least intentionally. And if I do unintentionally, I want an environment where they can come to me and say, hey, were you disappointed in me? I'll say, oh my goodness, no, I'm sorry. I have a cold and my energy's down. So I apologize, whatever it is. So I think that being genuine, being approachable, listening and understanding and checking your ego at the door, the secret ingredients, at least the foundation for successful leadership. You've got to at least have experienced the jobs and know enough about the business to help guide people, coach them. The competencies are assumed. It's those softer skills, I think, that make the difference. And those are transferable, whether it's a startup with 3 employees or a global corporation with 100,000.
Well, that's a good pause point to talk about the journey from 5 seats on milk carts to Wall Street. Let's talk for a second about the IPO and really the rapid trajectory to get from 5 to 200 employees. I'm imagining it being in your shoes and thinking about the IPO and the planning that goes into it, the preparation that goes into it, and the anticipation. How's this going to turn out? So it would be great to get a little bit of a snapshot before, and then how things have played out since.
Oh, sure. And look, what I'll say, first, I'm just very proud that in less than 3 years, we were able to build this amazing company from 4 or 5 employees on a milk crate to this almost approaching 200-person organization by the middle of this year that's been so successful in helping patients, in bringing this amazing medicine forward to help these people who are living with a chronic lifelong disease that really is devastating and can have a devastating impact on their life. And we've given them new hope and a new option, which feels really great. So that mission has carried us forward. The IPO itself put us in a robust cash position, obviously. We exceeded expectations there. It was really great to do that from the seat of Pennsylvania as a Pennsylvania startup, to have this successful IPO where we broke the shoe and exceeded expectations, and investors are excited, and as excited as we are about our future, which is really great. And we have a really robust group of current investors that are insiders who were private equity investors who help believe in the firm, bring us together as a firm and support us, many of whom are on our board of directors, who have provided amazing guidance and support all along the way. I would say when it comes to an IPO, it's a lot of work, Joe. to go from a private company to a public company. For all of my colleagues in the Pennsylvania community and elsewhere who might wind up watching some of this video someday, if they can sit through the whole thing, of course, there's my humility, right? But I would say it's a lot of work, and it's changed leadership. Because as a private company, you're doing things the right way, and you're always trying to, but you're growing. You're adding 10, 15 people each quarter, and you're 30 people. Now we're 45. We now have a new accounting system. You're in a rhythm as a private organization. The public company preparation in and of itself is an amazing journey. It took us almost a year. Writing your prospectus. You've seen those documents that come in the mail if you're a stock investor, right? Do you go through them front to back? Someone sat down in a room together and thought about every word on every one of those pages. The legal requirements, the reporting commitments, the systems and the infrastructure upgrades and changes that you need to make. It's a massive change initiative, and it particularly draws the attention of your senior leadership team. In parallel, we did this in the middle of our first product launch. We were 4 months into launching Wakix in the United States when the pandemic hit. And 4.5 months later, we signed up for an IPO. We were preparing in parallel. So imagine the challenge for myself as a CEO, for Nancy and Kate, who you met earlier, for each of the leaders on our team, who our employees are looking up to lead, being pulled. And to do an IPO is almost a full-time job on top of launching a drug. But we did it successfully. I'm very proud of that. So is the team. We lie on the field of battle, exhausted but victorious, so to speak. And now we're in this public company rhythm. Past our first quarterly earnings call, we'll have our second one in March, and we're very excited to be in front of investors again for that in this new arena.
What a great story. Well, John, you've chosen, you and your leadership team and the organization has chosen to grow here in Philadelphia. And it's an exciting time to be in Philadelphia, but it's also a decision to be here. How was that decision made? How is that going? And what are the opportunities here in Philadelphia for you to really get to the full growth and trajectory of your company?
It's a great question, Joe. And I have to say, now that I've lived in Pennsylvania and the Philadelphia region for over 22 years, I consider myself, and obviously my family are all Philadelphians at this point. Though I grew up in New York, this is the longest time between high school and then going to university and moving back to New York City and then here that I've lived in one place. Same for my family, and Philadelphia is really our home. But it was a conscious choice, and not just because I happen to live here. That wasn't the basis of the choice. The reason is that Pennsylvania is a national leader in the life sciences industry. And Pittsburgh's got a lot out there. Philadelphia in particular has a history and a legacy of CNS, neuroscience, innovation. There were a lot of big pharmaceutical companies here. You had GSK and Wyeth and Pfizer and others. Some of those have moved away to New Jersey and other states, but at the same time, there's been a renaissance of innovation and new, smaller startup companies starting in Philly. The primary reason was the talent base, because you had the invention of Nuvigil, Provigil, Cephalon. You may remember Cephalon and Frank Baldino, the amazing leader of Cephalon. I had the chance to work with Frank for a brief period of time. So did our CMO, our Chief Medical Officer, Jeffrey Dana, who was involved here in the Pennsylvania region, the Philly region, with the clinical development of Nuvigil. And now that's a leading narcolepsy therapy. It's now generic. So when you think about the connection then to a company that's starting in narcolepsy with Wakix, we've got employees in our company who worked at Cephalon, who led, including myself, that franchise of products, frankly. So there's this experience in CNS and in the big and medium-sized pharma where that rigor and that discipline comes from, here in this corridor between New York City, Wilmington, and Philadelphia, that you have regionally in Philly, an amazing talent base that has not relocated, even though the big pharmas might have moved across the state border. They're here, and they're looking for exciting, innovative opportunities. And these employees have years of experience based on that history. So that's why we chose. And especially since we're focused in neurology, rare disease, CNS disorders, wow, there's a hotbed of talent here, and folks that are looking to stay, to continue to raise their families here. They don't want to move. And so we've got that beautiful mix. On top of that, you have $88 billion plus in economic revenue generated for the state of Pennsylvania by the life sciences industry. You've got over 100,000 jobs that pharma provides across the state of Pennsylvania, many of which are in the Philadelphia region, and over 230,000 tangential jobs that are created through indirect service organizations, advertising agencies, restaurants, and other suppliers who really are all counting on that industry to provide them with a living as that industry innovates and provides future hope for patients. The state understands that, the governor and the legislators understand that, and it's a relatively friendly state and region for pharma and biotech. The last point I'll make is our amazing university system. 7 of the top 100 universities in the United States are right here in Philadelphia, right here in Pennsylvania, frankly, including Pittsburgh. And you have Penn down in Philly and Jefferson. Our chief medical officer sits on the board of Jefferson. He's a Jefferson trained neurologist. So, and Jefferson, as you know, does a lot for the local community, especially our citizens who are less fortunate economically and need medical care. But Philly's a great city for tech transfer, for innovation at the university level, at the pharma level, and a big focus now is raising capital, Joe, and bringing more private equity and public equity capital, frankly, into the Philadelphia region to help fuel this sort of beginning foundation of new innovative startups starting to put their offices here. It's a really exciting time, I think, in the beginning of a new renaissance for Philly life sciences.
It really is. Yeah. John, as we start to wrap up, let's just look ahead to the future for a second. Well, what are the factors that are going to be really important to your continued growth and success?
Well, thank you, Joe, for that. And look, I'll just say we like to keep things simple at Harmony, and I think we think in threes, with strategies and pillars and those. So we have three pillars to our growth strategy for future success of Harmony, and that first pillar is just keep doing what we're doing really well, bringing WAKIX forward to help patients who are currently living with narcolepsy, and continue to execute well on that launch, continue to drive forward our payer coverage so patients have access to the drug. We've done a good job with that as a company and a team. It's what we're starting with, and we're going to keep doing a great job. So nice and simple, keep executing. Number 2 is then our drug WAKIX is quite a unique therapy, and it's a histamine modulator. It's not a sleep medication. It modulates histamine in the hypothalamus and the CNS. It helps with wakefulness, but it could also help with many other things: cognition, vigilance, hunger, satiety, right? So we're going to be expanding the utility of WAKIX through new clinical programs. We're already in the clinic with 3 different programs: Prader-Willi syndrome, devastating rare disease that affects children and adults; myotonic dystrophy. There's a way that WAKIX could help patients here where they might not have had a lot of hope before. So we're in the clinic there to expand the utility of our existing asset right now. And the third pillar is we won't be a one product company forever. So we intend to buy additional assets. That means potentially raising more capital to do so, Joe, right here in the Philadelphia region, and bringing more innovation here, pulling it in from our universities or from other parts of the country to bring it right here home to Philadelphia and build that out. So that's how we intend to grow. An important underpinning to that and the foundation of that, though, that's a strategy. We can put that on a PowerPoint slide. We have the name of the company on the outside of the brick and mortar building with some windows and glass doors inside and that stuff, but that's not the company. What makes the company are each and every individual employee that we've got. That's the heartbeat of Harmony, or the collective heartbeats of 180 to 200 human beings who are dedicating 40, 50, 60 hours a week or more of their time every week to bring these innovations forward and to have their own career dreams fulfilled right here in the Philadelphia region. So keeping our culture strong is really important. And I think as companies grow, Joe, as companies move through massive transformations, like going public from a private small organization, rapid growth, new personalities and habits and systems coming in just when you're in a rhythm on what you're building yourself, managing all of that, leading all of that takes a big heart, a very small ego, a lot of humility, a lot of patience, and a lot of focus. We can't assume, just because we were certified a great place to work by the organization, Great Place to Work, and recognized by Fortune magazine last year as a top 10 biotech to work for due to culture. What a great honor. It's not the badge or the label that goes on the website. It's the fact that our employees voted for that in anonymous surveys. It means we're at least doing enough right that they feel welcome and supported and that they have a growth opportunity themselves. We can't let that go. That's so important. If we lose the hearts and minds of our employees, we lose harmony. So that's important. And finally, the last point, I think keeping our humility, starting with me, it's CEO letters, people, oh, CEO, I see myself as the first servant of everyone else, our patients, our shareholders, and our employees. It's my obligation to make sure I'm doing everything I can to pay it forward for those constituents. But keeping as a team our gratefulness for the opportunity, our gratefulness that we can have an impact with our lives and what we choose to do, how we earn a living for our families could actually provide life or opportunity for other human beings and their families. That's an amazing payback. That's what it's really about. And those traits are critical for any leader, any team, any organization, but I think you can lose those things and lose sight of those things as you're trying to make a quarterly number, as you're trying to keep the stock price at a certain level. My commitment to myself and to our employees, and I know our leadership team feels the same way, and so do our people, is that we won't lose sight of that humility, that gratefulness, and the heart of harmony, which is about caring about patients and our employees with everything we've got. And if we do that right, the success comes. It comes from those things. A very important piece, I'll wrap with this, is also giving back to our local community here in Philadelphia, and also as we get bigger and more successful around the country. I mean, Cristo Rey, you may be familiar, is a school in Philadelphia that gives underprivileged youth an opportunity. Harmony's putting several children, young adults with great potential through that school at our expense. Our first graduate occurred the other day, and he's going to Villanova University now, where he might not have had that opportunity had he stayed in the school he was in before. We've given our employees have hand-wrapped gifts for cancer patients, even though we're not in cancer, right? So it's not about just giving to the patient communities of the drugs we serve that they may take our drug. It's not about that. It's about giving back. We're not an oncology company, but we've given holiday gifts to families who have a loved one suffering from cancer who can't work or can't get to the store to buy presents for their children. This bonds our employees together. It gives us a greater purpose. And so we won't lose sight of those things. And as we have been granted opportunity and power, if you will, as executives, we have an obligation, in my opinion, to give back. That's a gift. The title of CEO, the title of vice president or leader comes with an equal, or I think even a heavier weight of obligation to give back.
John, that's quite a story.
Thanks.
Right, your story, the philosophy of the company, where you are in your trajectory. It's a very exciting moment. Congratulations on everything that has been accomplished, and more importantly, to have navigated everything you did in the face of pandemic, and looking ahead to everything that's possible. We're excited. We look forward to getting back together with you soon. Thank you for being generous with your time today. It was great to be with you.
Thank you, Joe, for being willing to listen to our story and being such a gracious host. I truly appreciate it very much. All the best to you and everyone at your organization. Appreciate it.
Thanks.
Thanks.